Alrighty guys, it's Gus back again from Pharmacy Down Under, back with another video for you all. Now this time we're going to be talking about something called conjunctivitis. It's a very common over-the-counter request that you'll be asked about almost on a daily basis. Now just for some context, the other day on our Instagram page we ran a quiz asking all of you guys a variety of symptoms, and you guys had to determine what type of conjunctivitis it is. Now, surprisingly enough, we had a pretty 50-50 split amongst all of you. Some of you guys thought it was viral, some of you guys thought it was bacterial, and some of you guys even chose that you didn't know at all. So today I want to prioritize and specifically talk about the three main types of conjunctivitis in this video, how to diagnose each of them, how to treat, and what to look out for, especially in the exam scenarios. Come with me, let's get started. Okay, so the definition of conjunctivitis. Conjunctivitis usually means an infection in the conjunctiva, which is an actual portion of your eye. Now, the thing is, when it comes to the symptoms of conjunctivitis, it's a very generic and very broad symptoms that actually are very similar amongst all three types. So when it comes to the actual types of conjunctivitis that we're talking about, it's usually either three of them. So either number one, bacterial, number two, allergic, or number three, viral. Now, how do you diagnose between them? What the differences are between them? I'll go through that now with you. All right, so now starting with bacterial conjunctivitis, that is usually going to be the most common presentation of conjunctivitis that you'll see in the community. The way you get bacterial conjunctivitis is just from the name, from a bacteria. So some sort of bacteria has infected the eye, and the conjunctiva in particular, causing the infection to spread. Now, in terms of the types of bacterial strains that can be linked to bacterial conjunctivitis, I'll just pop them on the screen here. There's a few of them out there. So it could be something as simple as a bit of staph or a bit of strep, and it could be a bit more advanced. Now, in terms of the actual presentation of the symptoms of bacterial conjunctivitis, the main ones, of course, are going to be your distinctive yellow, green, sticky discharge accumulating in the eye, typically first thing in the morning for most patients. And also a lot of patients also feel that sensation that the eyelids are actually stuck together and they have to physically peel open their eye first thing in the morning when they wake up. Essentially what happens is that mucus, or that discharge accumulates and builds up in the eye line and forces both sides of the eyelid to essentially glue together. Now, that's a really common side effect, a really common, symptom rather, but nothing to be concerned about. Now, another additional symptom that could be involved is red eyes, itchy eyes, irritability, and an overall sense of discomfort in the eyes. Now, when it comes to how do you get bacterial conjunctivitis, or how does it spread? Typically, it can be spread through a few different ways. The most common one is through sort of a hand-to-hand contact with other people who also have the bacteria, and it can spread to you that way. So it's very common, for example, for children to spread it to other children, and then children spreading it to their parents, and then their parents spreading it to other adults. Very common sort of way it spreads. It can also be spread by actual incorrect cleaning of contact lenses over time, can lead to accumulation of bacteria on the lens, and once you put the lens back in the eye, it can set off that infection. Okay. Now, when we're talking about treatments for bacterial conjunctivitis, typically there's one really good option to be used in the community pharmacy. It's called Chlorcig eye drops. So Chlorcig eye drops has an active ingredient called chloramphenicol in there. Now, the whole purpose of chloramphenicol is that it's a very good general antibiotic, broad spectrum antibiotic that's going to hopefully attack and kill that range of bacteria that could be in the eye. Now, the dosage is variable, as there's two different dosage forms for the eye drops. Now, there's one form that's an eye ointment, and there's another form that's an eye drop. So typically, for most people, they opt for the eye drop just because of ease of use, but the eye ointment is also another option if you don't like to use drops. The actual dosing for Chlorcig eye drops, the dosage is typically 1 to 2 drops every about 4 to 6 hours for about 5 days max. Typically, in terms of benefits, you should see some sort of improvement after 2 days of use. However, if it's not working after 2 days, that's when you need to refer the patient to the doctor. Now, in terms of the eye ointment, it works a little bit differently. It is an ointment similar in texture to like Vaseline. So it's very greasy, very thick. Now, the way to use the eye ointment is you need to draw down the eyelid and apply a 1.5 centimeter dose inside the eye. Now, that can be repeated up to every 3 hours for 5 days again total. So another additional thing that you can suggest to a lot of your patients when treating any sort of conjunctivitis, but in particular bacterial conjunctivitis, is eye wipes. So an eye wipe essentially is a hyperallergenic sterile wipe that's available in any community pharmacy in multiple different brands. Now, typically you want to find one that's got saline in there and is fragrance-free and perfume-free, which the majority are. Now, the whole point is that the eye wipe is going to wipe that discharge off the eye and prevent it from transferring from, say, a child to a parent if the parent parents taking care of them, and from adult to adult as well. All right, so moving on to allergic and viral conjunctivitis. So let's start with allergic conjunctivitis. Typically speaking, a lot of pharmacy students I've noticed, and even just general pharmacists in general, get them mixed up between allergic and bacterial. Now, there's actually quite a big difference between the two. The main difference between the two is that bacterial conjunctivitis, you will develop that green, yellow, typical sort of mucousy discharge, whereas allergic conjunctivitis, you're gonna have a distinctive milky white discharge. So other than that, the symptoms are very similar and they do overlap quite a bit, but the main thing is the color of the discharge. So when it comes to treating allergic conjunctivitis, it's actually really easy. Now, I usually recommend two things depending on the scenario. Typically for most people, about 90% of cases, all you need is just either an antihistamine eye drop or a mast cell stabilizer eye drop. Now, the ones that usually come to mind are the ones I recommend typically is ones called ketotifen, with the brand names called Zaditin eye drops. It's a very good anti-inflammatory, anti-allergy eye drop that can be used just twice a day. So it's one drop in the morning, one drop at night for about 5 to 6 days, and it should clear up. There are plenty of other eye drops out there, where it be just your nafazolone or any sort of decongestant allergy eye drop that you can also use too. I just prefer ketotifen just because of the ease of use, just a twice daily dosing. Now, on top of this, you can also recommend oral antihistamines if it's suitable for the person, depending on age and other medical health conditions. So if they are generally okay and no other complications and are an adult, they can use antihistamines like Claritine, Zyrtec, Telfast in conjunction with the eye drop if necessary. But that being said, you can still also recommend the eye wipes just to moisturize the eye and get rid of any debris and discharge that's causing any discomfort. All right, now lastly, we're going to talk about viral conjunctivitis. So viral conjunctivitis, just as the name denotes, is conjunctivitis that's usually linked to some sort of viral infection as opposed to bacterial. So how do you get viral conjunctivitis and how often do you get it and how do you treat it? Well, typically viral conjunctivitis is usually always associated to a previous viral infection. So for example, in our Instagram case scenario that we had posted the other day, the situation was that you had a patient had just recovered from a URTI, which is an upper respiratory tract infection. Now, the whole idea is that after recovering from an upper respiratory tract infection, you are more susceptible to develop viral conjunctivitis as that virus escapes up the upper respiratory tract. So it's very common, super common to develop some sort of watery, itchy eyes, a discharge potentially in cases post cold and flu. So that's a really interesting one that you will encounter on a daily basis in the pharmacy, but is not really expected in the patient's mind. Most patients get confused when they hear about the terminology of viral versus bacterial. So it's really important to educate the patient that viral and bacteria are very different. So you can't use Chlorcig and antibiotics in a case of viral conjunctivitis. Because of the virus, there is no real medicine for it to treat it directly. It's a time game. It will heal on its own, just takes a few days. However, I also suggest eye wipes and artificial tears just to lubricate the eye and to clean up any debris if there is any discomfort for the patient. But otherwise, no need to treat. I usually recommend a combination of usually a lid wipe or some sort of cold compress and a lubricating eye drop just to make sure you're covering all of those discomfort points that the patient might have. Right, so that sums up pretty much. So we covered 3 different types of conjunctivitis today. We covered bacterial, allergic and viral, and now we know the difference between all 3. So that's a really important one that you will encounter on a regular basis. And I can guarantee you will have some sort of exam question that's referring to either one of those 3 types. So you need to know the difference. You need to know how to diagnose and differentially diagnose each one, and to know when to refer, and to know what dosage to give of what medicine. If you liked the video today, that's fantastic. Make sure you're commenting below and liking the video, and of course subscribing if you're not already. Otherwise, spread the word and make sure you're following us on our socials on Instagram and on TikTok, as well as the newsletter linked below. Thanks so much for your time, and yeah, follow us for more. See you next time. Bye.